Hi, my name is Kayla Sanchez, and I'm going to be talking about respiratory syncytial virus disease. And let me get my presentation up. 1 second. Come on. All right. So, like I said, I'm going to be talking about RSV disease, and what it is. It's a microbial disease of the respiratory system. It's the most common cause of viral respiratory disease in infants, and it's the most common cause of bronchiolitis and pneumonia in infants as well. So the causative agent is respiratory syncytial virus, and there's a picture of it right there. It's an RNA virus, and it's classified as a pneumovirus because it can cause life-threatening pneumonia in older adults. Um, it's commonly misdiagnosed as influenza as well as the common cold. Because the symptoms are so similar, it's easy to misdiagnose it as the flu or the cold. It can live on hard objects like crib rails or tables for hours, and on softer surfaces for not as long, but still a good amount of time. I say crib rails because it's most commonly seen around like newborns and infants. So on like those kind of hard objects, that's usually where you'll find it. The name is derived from its correct characteristics of causing cell fusion. So syncytium formation, that's the kind of like type of growth process. And you can see it when it's grown in cell culture. All right. RSV, it leads to about 14,000 deaths each year in the United States. And most of those are in older adults because it's most commonly seen in infants. RSV cases, they peak during the winter and early spring, but the RSV season is from fall to the end of spring. And here I have a chart of the positive PCR tests, and I got that from the morbidity and mortality weekly report that we talked about in class, CDC's website. And about 1% of all the cases result in hospitalization. So a very small amount of all the cases are severe enough to be to where the patient has to be hospitalized. Transmission. It can be spread through coughs, sneezes of an infected person, where the droplets will then enter through the eyes, nose, or mouth, and it'll infect the respiratory system. It can also be spread through direct contact with the virus. Like if you're kissing like a baby or something, like you can get it that way. And also the other way around. If you have it, you can pass it to a baby by like kissing them. I remember when we were little, my twin brothers, we had two of them. So my parents bought these little signs for the little carrier, and it says, please don't kiss, don't touch. And I never really knew why we had that on there. I just, as a kid, I'm like, oh, you don't want to get sick. But this was one of the reasons why you don't want them to get sick because um, it's very easy for babies to catch it. Another way of getting it is by touching a surface that's contaminated with the virus, like doorknobs, and then like touching your face before you wash your hands. That's one way of getting it up in your respiratory system. People who have weakened immune systems are more likely to spread it even after they've like gotten rid of the symptoms, and that can be for like up to 4 weeks or more. So um, you should keep clean to prevent yourself from getting sick. And I know children, like in their environments, like going to school or being in a childcare setting, it's very easy for them to pass those germs around. And they go, they get infected, they bring it home, and they get all their family members sick. So it's very important to stay clean and to wash your hands. And that brings me to my next point, prevention. Hand washing. Frequent hand washing is very important. And teaching children the importance of hand washing is necessary. Avoiding exposure. You cover your mouth and nose when you cough or sneeze. And if you have a baby, limit their contact with people who have like fever or cold because you just want to avoid it altogether. And keep things clean. Wash down countertops, kitchen, bathroom, doorknobs, handles need to be kept clean, and immediately discard used tissues. I'm so sorry, I can't talk right now. Don't share drinking glasses with others. use your own cup, or if you don't have any like glasses or something, use disposable cups. And make sure you label it so you don't get the cups mixed up and get sick. And once again, if you have a baby, wash their toys regularly. If they're sick or if somebody else is sick that you know of, you don't want them to get sick through those toys because babies like put it in their mouth. They like mess with them and they get it all nasty. All right. Signs and symptoms. There's like three stages of the symptoms. The first one is like upper respiratory symptoms and fever. Fever is only like seen when there's bacterial complications. But another possible symptom in that first stage is apnea. That's seen with like babies that are less than 6 months old. The second stage consists of like coughing, wheezing, and like a crackling chest noise. And these symptoms only last for a week or so. Unless it intensifies, and that gets you to the third stage, bronchiolitis and pneumonia. My little brother, when he was like 3 or so, he had gotten sick. You know, we thought it was flu or something because he was also asthmatic, but he had RSV and it led to him getting pneumonia and he was very sick for a good while. So when you see symptoms like this, just be careful. Go see a doctor, get it checked out. The signs and symptoms in healthy adults and older children are mild. So they shouldn't be as intense, but you should still be cautious. Some risk factors. These are people that are most likely to get sick with RSV disease. That's like infants, premature babies, or babies that are 6 months or younger are most at risk of getting the disease, and elderly people. So like the older ages, they're also most likely to get sick because of weakened immune systems. Children with heart disease or chronic lung disease from birth, they're also very at risk. Immunocompromised and people with neuromuscular or cardiopulmonary disorders. Those are all the people that are most at risk of getting a severe case of RSV. Because everybody gets it, by the age of 2 or 3, everybody gets it. All right, pathogenesis. The pathogenesis of RSV virus, there's 3 steps. The first one is attachment and entry. During this stage, the infection begins at like the nasal epithelial cells, and there the G proteins, the part of the cell or the part of the virus, it attaches to the host cell. The G protein is the one that activates that. The F protein mediates virus envelope fusion with the plasma membrane. And from there, the fusion enables the release of nucleocapsid and genomic RNA into the infected cell. And I'll talk more about the proteins in the next slide, but that's the first step. The second step is viral transcription and fusion. The RSV genome is transcribed from the 3' to the 5' end. So it's just transcribed and then it replicates that one template. And then the last step is viral assembly and budding. Newly synthesized viral proteins, the genomic RNAs and glycoproteins are incorporated into viral filaments. So they're all assembled and put together. And then after assembly, the mature virion separates itself and buds out of the cell. And that's how it spreads. Virulence factors. Like I previously mentioned, the G protein, it's also known as the attachment glycoprotein or just glycoprotein. I have the picture here and you can see the glycoprotein. And that one, it's a unique glycoprotein. Most pneumoviruses, they have glycoproteins, but the structure is different from the one in RSV. It has very little in common, but its job is to attach to the host cell. Then we have the F protein, or the fusion glycoprotein, and it plays a key role in viral entry and fusion. That's how it gets into the cell. Diagnosis. So because it's an RNA virus, the most common way to diagnose it is with reverse transcriptase polymerase chain reaction. We're all probably we hear it often in class, and this is one of the reasons why it's used to diagnose RSV and many other viruses and diseases. This one's the most commonly used because it's more sensitive than the antigen testing or just regular culture. And then we have the antigen testing. The antigen testing, it's very useful for little kids and infants, but for adults, it's not as sensitive. So it's not really recommended. The RT-PCR is more recommended because of its sensitivity for older older children and older adults. The less commonly used methods of diagnosing, there's the viral culture and serology. The serology is used only for research and surveillance studies and things of that sort. And then we have treatment. Because you can't really treat a virus, you can only treat the symptoms. So you want to manage fever and pain. You can take over-the-counter pain and fever relief medicines like acetaminophen or ibuprofen, and you can switch out between those. And you also need to drink a lot of fluids because you want to prevent dehydration when you're sick. You get dehydrated, that's not good. And then just talk to your healthcare provider. And because it's most common in children and infants, there are many medications that they have ingredients that are not good for them. So you want to talk to a doctor, healthcare provider to make sure that it's safe for use. Because there's no specific treatment, there are still vaccines and antivirals that are being developed. We haven't gotten there yet, but it's still in the process. And this wasn't required, but I thought it'd be interesting to put this in here. Some complications. RSV can lead to hospitalization if it gets severe enough, and then pneumonia. Pneumonia and bronchiolitis are the most common results of severe RSV. And that's like when the infection spreads to the lower respiratory tract. Then you have middle ear infection. That happens when germs get behind the eardrums and it leads to an infection. And then asthma. People with asthma, there's found to be a link back to RSV. So if they get RSV when they're young, they're likely to develop asthma in the future. And then lastly, repeated infections. If you get it once, you can still get it again. It's kind of like COVID though, where you get the first time you get infected and it's kind of severe, but the second time it's not as bad. It's the same thing here. The first time you get it, it's kind of mild, but the second time it's not as severe. But it can be severe with older adults and people who are immunodeficient and with heart and lung disease. And yep, that's it. There's my works cited for my images and then for my information. Thank you for your time. And yep, we'll see you.